So one of the questions that we will frequently have is about macular degeneration. Most of the patients that we see here in Mexico that are coming from visit or they have partial living in Mexico in one of our locations, it's about macular degeneration, age-related macular degeneration. So many of those patients are people that are coming just for a few months. They are receiving treatment in the US or Canada for macular degeneration, and they have many questions about what to do and how they can be treated here in Mexico. So let me just share with you a few things that we have found constantly in our consultation. And the first question is, what is the best treatment available for macular degeneration? The answer is very simple. It's probably the medication that you're receiving. There is recently just anti-angiogenic medication. This medication, what they do is to reduce the size and the number of vessels that exist on the retina. And these vessels are diminished with injection. Usually, the treatment lasts between 4 to 6, maybe 8 weeks. In a few cases, can go up to 12 weeks, depending on the medication that is being used. But one more time, the best medication that you can receive is just stimulate or use something very similar for the medication that we're using back home. And most of the medications are available. That's probably the second more asked question is, which medications are available in Mexico? Can I receive the same treatment? And the answer is yes. So far we have most of the medication, if it is not everyone, but basically we can just receive the medications in probably 4 of them that are the most frequently used. The first one is Avastin or bevacizumab. This medication is the oldest one of all, is the cheapest one, and is most of the time used out of label. It is not specifically used for eyes, but is a very effective medication. And always you have to consult with your doctor about what are the benefits and how can we use this medication. The second one is Lucentis, very similar to bevacizumab or Avastin. This medication is basically used because it's not out of label. It's most of the times covered by most of the insurance in the US, and many of the insurance in Mexico is covered. So that's the second option. A third one is a newer medication. It's called aflibercept. It's also known as Eylea. This medication has the benefit that is longer last duration. It means that between shots, the patient can wait up to 12 weeks in a few cases, most of them 8 weeks, and is one of the most used medications recently. And the newest one is called Vabysmo, that sometimes can last up to 16 weeks, according to the most recent studies. All of these medications are available in Mexico, and it's possible to use them. And the next question that we most recently have is, how do I know that I need my treatment for macular degeneration, or can I wait a little bit longer? So this is basically done based on a test that is called OCT test. That test is one test that is optical laser that can scan the retina and look for inflammation and accumulation of liquid. We found these kind of things. That means that the patient needs treatment. And when there is no liquid, that's when we can start doing some treatment that is called treat and extend, which means that we can have a shot and extend. Even the most safe way is to extend in a period of 2 weeks in between shots. And if the vision is stable, the patient is not losing vision, and there is no liquid or inflammation on the retina, then we can extend. If we find inflammation of liquid, the best thing to do is to apply the medication. So basically, the short answer is, you need treatment when you have liquid or inflammation on the retina or your vision is decreased. And the next question that we usually have is, if it is possible to personalize treatment for AMD or macular degeneration, the question is yes, and it's basically that. What we usually do in the clinic is, when the patient has no liquid, we personalize the treatment and extend the treatment between shots, so the patient can receive the less number of shots per year. And that is the best way to personalize. And that is based on the OCT test. The OCT test, in my opinion, should be done every single visit that you have with your retina specialist. Regarding to the medication, well, we always like to start with the less expensive and the easiest medication to get. And if there is some resistance or the patient is not responding well with the quantity of liquid or the quality of vision that they are having, that's when we decide to change medication. But that usually has to be very personalized treatment. Next question is, how is the process of an injection in Mexico? So the process is basically the same one that you're receiving with your doctor back home. So you can decide between two ways to do it. The first one is going into a OR, so you have a very safety environment free of contaminants under the injection there. That way you reduce the risk of infections, but takes longer and usually gets more expensive because we have to take in count the cost of getting into the OR. And the easiest way, that's my preferred way that we usually do, we do it in the office. And that's quite safe. We know that the risk of infection is really low. Probably around 1 in 1,000 cases can have an infection, but most cases is controlled. Following all the procedures to have a very clean procedure, like cleaning the area or using an antiseptic before the injection. And with this kind of procedures, the risk of having an infection is really low. So we can do this in the office. Most of the cases, because it's less time consuming, reducing the cost, that's our preferred way. But of course, you can decide between both, and you can talk with your doctor about which way you like to do it better. Also, you can have an anesthesia if you feel too anxious to receive the injection. Just knowing that it's not a painful, meaning you have experienced that before, there is a little pressure that you feel during the injection, but most of the time it should be painful. And finally, one of the questions that we have is how painful it is and if there is any way to reduce the pain. And regarding to this, remember that your mindset and the way that you're thinking about the injection is also going to change all the hormones and substances that the brain is producing. And if you are relaxed and ready for the injection, you are going to experience less pain, because pain is a very subliminal way of thinking, or something that you can control very easily when you are decided to do it. So pain can be relative to every patient when they receive an injection. Most of the time, the area that we inject has no vessels, has no nerves, so usually there is painless. So that's it. I hope that this information will help you on your next visit to Mexico, and you feel safe that you are having a good treatment with a good retina specialist. Thank you.